Many people do this every day without realizing the danger. Imagine a normal morning. You wake up, walk into the kitchen, pour yourself a glass of water, or make some tea. You open the refrigerator, take your breakfast, and everything feels normal. Just another day. The same routine, the same habits you've been repeating for years without even thinking about them. But right at that moment, you may be doing something that slowly damages your kidneys, and you don't even realize it. Not something from a hospital, not medicine, not something rare or expensive, but something that millions of people consume every single day and believe is completely harmless. During my medical career, I have seen thousands of patients with kidney problems. And the saddest part is that many of them lived what they thought was a healthy life. They didn't smoke, didn't drink much alcohol, tried to eat properly, and believed they were taking care of their health. But their kidneys were still slowly getting worse year after year. Your kidneys are some of the hardest working organs in your body. They work 24 hours a day, every single day, without rest. They filter your blood, remove toxins, control blood pressure, and maintain the balance of fluids and minerals in your body. And the most dangerous thing about kidney disease is that kidneys often don't hurt. A person can live for years without knowing that their kidneys are already under serious stress. By the time symptoms appear, the damage is often already advanced. Many patients told me the same thing. Doctor, nothing was hurting. I felt fine. And that is exactly the problem. Kidney damage happens quietly, slowly, and almost without noticeable symptoms. And in many cases, the cause is not a rare disease. The cause is everyday habits. Today, I want to talk about several things that people eat or drink almost every day, and they don't realize how much harm these habits can cause to the kidneys. The first problem is too much salt. As people get older, their taste becomes less sensitive and food starts to taste bland. So people begin adding more and more salt without realizing it. But too much salt increases blood pressure, causes the body to retain water, and puts extra pressure on the kidneys. Over time, the small blood vessels in the kidneys become damaged, and kidney function begins to decline. That is why many people with kidney problems also have high blood pressure. These two problems are often connected. The second dangerous habit is sugar and sweet drinks. Many people think sugar only affects weight or diabetes, but it also damages blood vessels, including the tiny vessels in the kidneys. Over time, high sugar levels can lead to kidney damage, especially in people with diabetes. I have seen many people who didn't eat a lot of candy or desserts, but they drank sweet tea, juice, or soda every day. They didn't think it was dangerous. But for the kidneys, this creates a very heavy workload. The third problem is dehydration. Many people, especially older adults, do not drink enough plain water. They drink tea, coffee, or other drinks and think that it is enough. But tea is not the same as water. Coffee is not the same as water. Sweet drinks are definitely not water. When the body does not have enough water, the blood becomes thicker and the kidneys have to work harder to filter all them. Over time, this can reduce kidney function. I often tell my patients a very simple sentence. Kidneys love water and hate everything else. The fourth dangerous thing that is frequent use of painkillers. Many people take pain medications regularly for back pain, joint pain, or headaches, and they take these pills for years. But many painkillers can slowly damage the kidneys, especially if they are taken often and without medical supervision. I have seen patients who ended up on dialysis after years of regular painkiller use, and they never knew that these medications could damage their kidneys. Remember one very important thing. Kidney damage does not happen in one day. It does not happen in 1 month. It happens slowly, sometimes over many years. While a person continues the same daily habits, there are early warning signs you should pay attention to. Swelling in the legs, swelling around the eyes in the morning, frequent urination at night, constant fatigue, high blood pressure, dry mouth, foamy or dark urine. These can be early signs that your kidneys are under stress, but many people ignore these signs. They think, it's just age. I'm just tired. It's probably my blood pressure. It will go away. And years pass. Then one day they do blood tests and find out that their kidneys are working at only 40% or even 30%. And life changes completely. Medications, diet restrictions, constant tests, sometimes dialysis. That is why I always tell my patients something very simple. Take care of your kidneys while they are still healthy. Drink enough water, eat less salt, reduce sugar, do not take painkillers unless necessary. Control your blood pressure. Check your blood and urine at least once a year. These simple habits can protect your kidneys for many years. Sometimes health does not depend on expensive treatments or complicated procedures. Sometimes it depends on simple daily habits. If you remember even half of what I told you today, you will already be doing a lot for your kidneys. Take care of yourself, take care of your health, and remember your kidneys work for you every day. Help them work as long as possible. Stay healthy, and if this information was helpful, subscribe to the channel for more health and longevity advice.